I was just going to get us started it's afternoon from where I am, early morning where Brigette is. It is just my deep, deep pleasure to be ending our three-part seminar series on policing and health and kind of the structures of the criminal legal system in general as a public health issue with our friend and colleague and just really kind of inspiring person, Dr. Brigette Davis. And so before we launch into this, I just wanted to remind everyone of a couple of housekeeping things. Usually this is a Tyler Harvey role, and so I hope I'm not missing anything, but I'm just looking through. We're hoping that this is, as always, a real conversation for us to kind of deepen our own knowledge and expertise around policing and health measurement. We've had two seminar speakers already that for me really pushed kind of what it is that I know about sleep deficiency, sleep health disparities, and how that's impacted by a criminal legal system at a population level. A second seminar series, if y'all missed it, Dr. Lisa Boleg, who then started pushing us to think about intersectionality and how it impacts the experiences of police brutality, really thinking again about the measurement of the multiple different identities that we all inhabit. And today, lastly, we're going to end here with Dr. Davis speaking to us about some of the new work that she's taking on, again, looking at, and some old work, looking at the structures of the criminal legal system, and in particular fines and fees and how that impacts us on a population and public health level. This is going to be a conversation. We're going to really try to get to kind of what are the issues she's grappling with, what insights does she have, also the person that she is, both, what motivates her to do this work. If you have questions for her or for us, please feel free to enter them in the Q&A session, and then we'll just try to address them throughout. I might pepper in some questions to myself. Also, you can, if you feel so inclined, raise your virtual hand, and you can also ask those questions live, and we'll unmute you briefly. This presentation, like all of our other presentations, are recorded and can be distributed to those who registered. And we wanted to thank the Center for Policing Equity, Phil Goff's group, for co-sponsoring this event. So without further ado, I'm going to introduce Brigette. So she's a social epidemiologist whose research really focuses specifically on the impacts of structural racism and health, with a particular interest in how structural racism is operationalized in research. And for me, I really kind of push upon you guys to look at her work and her research, and also her Twitter feed, which I think is really illuminating. It's really kind of, I think, really on the cusp of how best to measure, how much to think about structural racism, and what we do as scientists ourselves in reinforcing and reifying structural racism. That Brigette is like a loud and clairvoyant voice in this topic. She holds a BA from Swarthmore. She trained here at Yale School of Public Health, got her master's here, and it's here that we got to know her well and deeply, where she worked closely with our Transitions Clinic Network team, in particular in our first iteration of training community health workers, people that have been incarcerated themselves, in how best to interact with a structurally racist health system and how best to maneuver through that. Since then, she's gone on to get her PhD from the Harvard T.H. Chan School of Public Health, where she also won many accolades, including she was an RWJF Health Policy Research Scholar. She's currently now in beautiful Bay Area in San Francisco doing her postdoc now. I'll just start here by saying that while we've had a chance to get to know Brigette, I mean, I know that some folks on the line won't. And so I wonder if you could just tell us a little bit, it's like I get to interview you for tea time, Brigette, Dr. Davis, about what motivates you? Like, why are you doing this work? If I think about your own career trajectory, what kind of inspires you, keeps you in it, or where you're looking towards?
Yeah. Also, thank you for that introduction. It's crazy because I feel like I forgot about the deliverables, and I was like, oh yeah, we did do that whole training thing. It was really nice. And I feel like my time at the TCN was such a beautiful time, and also a reminder about why I guess I got into this work. I feel like after my master's degree, I feel like I had all these skills and things were going crazy in the world, like Trayvon Martin was killed. And I just kept thinking, like, I have all these skills and there's nothing I can do really with them, that there's not really a way to implement like my home and the things that I care about into the work in the way that I was taught it at Yale. I loved Yale, it was a fine institution, but there weren't a lot of places like the TCN who were, at least in my training at the time, who were sort of thinking about what it was like to be a Black person in America, and not just, be at high risk for heart disease, but actually living in a structure that can sometimes be a threat to our existence. And so I feel like the TCN and working with the community health workers and really the Trayvon Martin case is kind of what made me think about going home. And then right as I was going home, Mike Brown was murdered by the Ferguson police. And so then it all kind of came into focus, where it was like, oh, I thought I was like a genius. I was like, oh, it's not race, it's racism. I'm about to like blow the game out the water. And then it turns out, obviously, there's a rich history and like sort of like knowledge base of people thinking about this. And I just had to tap into it. And so that's how I ended up back in school, is really thinking about this and wanting to, just, I guess, take what has been known and what my experiences were and try to integrate that into something that would be useful.
That's right. I'd forgotten, like in the introduction, I'd forgotten that, of course, you ended up working in the St. Louis Department of Public Health and doing some really kind of interesting and like on the ground work, because you felt like that was kind of where things were maybe,
Well, I tried to, but they weren't happening.
I remember.
I wanted to, and they were like, so.
But even as I see your kind of career kind of move through, I mean, I think that that's part of it, is that, especially for myself, is always trying to think about kind of where your actions are kind of most fruitful and where they're most aligned with your values, and then also what new skill sets. I mean, it's just been a beautiful privilege for me to see you move through your career. And also really push yourself in that, right? Like, it's not doing it here, and then these are different skill sets that I can gain. And so back to school you went.
Back to school.
Yeah, that's right. And so you recently defended your PhD, and so just huge hats off. It's amazing to doing so. I wonder if you could tell us a little bit about what excites you, like in terms of your own research career. Like, what are the questions that are motivating you right now? What are you doing in your postdoc? What are you seeing for your future?
Yeah, I mean, so I think I'm going to talk about that a little bit in my presentation. So
okay, so then you don't need to go.
Are you sure?
Yeah.
Okay, because I have some things, and I'll talk about it in my presentation. I think you'll notice when I get really excited.
Perfect. Then why don't we, I'll just give the floor to you. And then again, we invite conversation. I think that you can see this is just for us, a place where we get to learn alongside you, Brigette. So if folks have questions, put in the Q&A. I'm going to do my best to moderate. I also will say that, as y'all know, or for those of you that are on the last webinar, I'm in Puerto Rico, where the internet sometimes will go out. So if I fade out, that's what's happened. And then Lisa Puglisi will take over. So without further ado.
Okay, thank you.
Dr. Davis.
Okay. Okay. So I'm not going to do too much of an introduction here, since we've already had an introduction. But like I mentioned before, I'm really interested in structural racism as an exposure in health and a causal factor for racial health disparities. And so my dissertation, which obviously I just defended, kind of revolved around this idea of how best do we measure it? How are different ways that we can stretch the operationalization and the conceptualization of it, so that that is aligned with the theory that we propose, which is that, again, it's racism and different forms of racism that are creating the racial health disparities that we see, rather than race itself. And so from there, I'm going to start with the definition of structural racism that I kind of thought about a lot. I mean, there's a lot of different versions that all sort of have a lot of similar properties, but this is the one that really motivated a lot of the work. And so this is from Dr. G. and Ford's 2011 paper. And they describe structural racism as the macro level systems, social forces, institutions, ideologies, and processes that interact with one another to generate and reinforce inequities among racial and ethnic groups. And I've added the emphasis to interact because I think that this interaction is the thing that I've been thinking about a lot in terms of how we can start to expand on our conceptualization of structural racism. So building off of that, I'm also going to draw from a G paper as well as Maggie Hicken. And this conceptualization was brought to me by one of my colleagues, Rebecca Israel Cross. And so at the UCA lab, they've been conceptualizing structural racism as this buckyball or a buckyball molecule, and it has a real name that I can't pronounce. But pretty much, and I'm going to try to keep it super short, how they've conceptualized it is that this buckyball is incredibly sturdy and durable because of the multiple linkages between the atoms, which are these red nodes, such that like if you were to remove a single connection between the atoms, the structure itself remains the same. And so they've conceptualized structural racism in this way, such that the red nodes or the atoms are like institutions, and then the connections are the multiple connections between these institutions. So I'm going to draw on an example that another one of my colleagues uses a lot, which is the connection between, I'm a little bit nervous, hands are shaking, we got to move the slides. All right, so the connection between school funding and property taxes, right? So this is a very sort of straightforward example of structural racism, whereby the ways that public schools are funded is through property taxes. Now we know that property taxes are influenced by housing appraisal, and we also know, people know internally already, and then we're starting to find out in research that discrimination influences housing appraisal, such that the same house in the same amount of bedrooms and styles, whatever, in a Black neighborhood would be devalued, where in a white neighborhood it would be valued. So we know that property taxes, which are influencing school funding and school quality, are also being influenced by racism in the banking and the appraisal industry. And we also know, again, that segregation allows allows for the varyings in valuation to exist. And then we have our through our school to prison pipeline and through other mechanisms, we also see the criminal legal justice system in here. And obviously this isn't like a true rendition of how these things are connected. It's just sort of a rendition of the fact that they actually are connected. And the reason I bring up these sort of multiple institutions and ideologies and forces is to remind us that, yes, structural racism is complex, and there are things that we have to think about that make it really difficult for us to measure it in research. But I also want to remind us that it's not so complicated or difficult to understand that we can't do anything about it, because most of us, Black folks in particular, have been living in a world where we have to navigate structural racism all the time. And we come up with creative and innovative ways to get around these systems. But they also put us in contact with other systems. So an example here is, thinking about mothers who've been sent to jail and sentenced for lying about their residency, again, the housing appraisal, the property taxes, to get their kids into better school districts, right? So, Mama Kelly Williams understands structural racism, even if it is hard for us to put it into an exposure variable in our research. So one of the things that I've been thinking about a lot is about how we measure structural racism. And one of the things that a recent study from like 2018 has shown that the majority of measures that are used to sort of operationalize structural racism has been through segregation. And so through segregation, we think things like, percent Black, which is sort of this proxy, like unidimensional measure for segregation. The dissimilarity index is one that's used a lot. The index of concentration at the extremes, or the ICE measure. These are all segregation measures that are used very often, predominantly in structural racism research. And then we have other examples of measures as well. So we have like proportional measures, so like the percent of people experiencing incarceration, percent unemployed, percent educational attainment, like that. So again, sort of a unidimensional measure of things that we know are associated with structural racism, such as labor discrimination and employment discrimination, income inequality, et cetera. And then we have these other measures of structural racism that tend to be sort of a disparity or disproportionality measure. So thinking about not just the percentage of Black people in the neighborhood with a history of incarceration, but sort of creating a ratio or a comparison to show a disparity between the two, or some composite score of these compositional measures. But the reason I bring these up is that whether we're talking about, let's say, the percentage Black, which is one that is used a lot in sort of segregation studies, although not necessarily structural racism, the dissimilarity index, which again is used quite often in structural racism research, or in these disparity level indices, what you'll notice is that in all instances, both the numerator and the denominator are the people themselves. And so even though we understand structural racism as something to be contextual, we believe it to be something that's happening in an environment that's influencing people's health through their existence in this environment, the majority of our measures still rely on the presence or absence of people in space. And so I argue, and other people have argued as well, and I get to that this actually does not move us away from, even though we are theorizing that structural racism is the cause, we're still using race as evidence of structural racism in our measures. And I'm obviously not the first person to think about this. I was really influenced by Dr. Sewell's race reification process paper, which if people have not read it, you should. And in it, they say that the health consequences of the actions and inactions of institutional gatekeepers in the segregation health link, they say segregation health, but I'm actually including all compositional measures, are not made explicit. And that by overlooking this political economy, it allows for the white institutional gatekeepers to never be implicated. So again, what they're saying is that by focusing on, again, either in segregation or any compositional measure, rather than focusing on the actions or the inactions of the people who create these environments, then we actually are letting the actors in the actions themselves off of the hook. And that's something that, again, really stuck with me when I heard them speak, and it kind of guided all of my research for my dissertation and hopefully in the future. So there are examples of non-compositional measures of structural racism. A lot of them have been focused on identifying mortgage discrimination, sort of in the financial, banking, institutional discrimination sort of land in their relationship with neighborhood segregation, using events related to structural racism. So Dr. Sewell does a lot of work with quantifying stop and frisk in a neighborhood, or police interactions, or police murders, or Jim Crow laws. And what I've been really interested in is sort of identifying, in addition to the things that we already have access to, avenues to measure other systems and processes in their relationships, so that we can expand our sort of repertoire of available measures for structural racism, measures or exposures. And so here I'm just going to introduce the idea of fees and fines as a type of structural racism, which maybe I'm speaking to, I'm preaching to the choir, I'm not sure, but this is, again, just kind of helps me move it forward. So to take a step back, I mentioned earlier when we were talking in the introduction that I'm from St. Louis. I was there during the Ferguson uprising. And so a lot of the things that were revealed to the world were things that we already knew about. But so after the murder of Mike Brown Jr., the Department of Justice created this investigation of the Ferguson Police Department that was sort of known as the Ferguson Report. And again, what it revealed, which is things that we already knew in St. Louis, is that the Ferguson city government specifically asked the Ferguson City Police Department to fill budgetary shortfalls using these low-level violations and crimes that were associated with fees and fines. We know that they were racially targeted. We know that they were focused on both residents and people who sort of moved through it. And these low-level crimes would be things like broken tail light, I don't know, walking in the street is one. Just all of these really things that are not really crimes, but are actually can be imposed and can extract money to fill this very specific need of the Ferguson city government. And so, like I said, in St. Louis, we already knew this, right? Like, you knew if you went down one road, you need to slow down because you're gonna get a ticket. But the reality is that the collection of revenue through fees and fines is not uncommon. So a study by UN Census in 2017 found that 86% of municipalities that have the necessary infrastructure do report some fees and fines as a type of revenue. And so the necessary infrastructure here means either they have a police department or they have a judiciary system. So they have the ability to collect fees and fines. Of those who do have the ability to collect fees and fines, the majority of them do. And in that same study, they found that that sort of nationwide, that the fees and fines per capita increased as the proportion of Black residents increased, and that it was also associated with, again, sort of budgetary shortfalls, so low overall revenues, as well as high police expenditures. Now, I was not exposed to this sort of thinking in my public health training, but people have been thinking about this, Alexis Harris being one of them. That comes straight to mind, has been thinking about this a lot. So obviously outside of an interdisciplinary fashion, other people have been thinking about this as well. And so people who have been thinking about the collection of fees and fines in this relationship between government and the police refer to the police as street level bureaucrats who have discretion to decide when and when not to impose these fines, specifically either to support their own budgets or to support the police budgets. So in these studies that have come out around this, they found that sort of if you lag like budget deficits, that you'll see an increase in low-level revenue generating crime. And actually, because of the shift in resources, you see a decrease in the solve rates of violent crimes, right? So that gets at this idea that that the function of police isn't necessarily the public safety. They've also found that racial concordance on like city councils tends to decrease revenue from fees and fines. So it kind of gets at the idea that this is discretionary, that people are making decisions about how to fill in their budgets. And then again, along with this research and other research, I found that the neighborhood composition predicts the amount of revenue generated through fees and fines and the sort of crime rates, right, that are associated with fees and fines. So again, this all just gets at the idea that these are that this is a discretionary act, and that it is motivated less about public safety and more about money. And so then we also know from others research, again, Dr. Harris, and even work that's come out of the ACLU, that the fees and fines, and again, most of us already know this if you live in a place that does this, we know that it's really harmful for individuals and families. So if you are poor, which most people are when they're being hit with a fine, because it's usually low-level things like your tail light isn't fixed, that if you don't pay them, that they accrue and become even more affordable. And then as these fines accrue, then you start to lose rights and privileges that further disenfranchise and take away the civil rights of individuals. So the loss of driver's license is really common. The woman and on the right is one of 4 women who was suing South Carolina for the loss of driver privileges due to traffic tickets, which is ridiculous. If you can't get to your job, then how are you gonna pay the money back? But in other places, like in Chicago, having unpaid fees and fines could exclude you from governmental jobs. In lots of places, St. Louis included, they can lead to warrants for your arrest. Loss of voting rights, I believe in Florida, it affects your credit and it might not be cleared up to bankruptcy. So in addition to the sort of police surveillance issues around fees and fines, then we also know that there's an extractive process that is especially devastating for poor people. Most people don't have, savings or the kind of money that could allow them to easily pay a $100 ticket. But we know that these tickets or the fees and fines or the bails or what have you are not designed to actually stop crime, but it's meant to punish and again to fill in these governmental budget gaps. And then finally, we know that the opportunity to collect revenue, the potential to collect revenue, gives police probable cause to interact with civilians, and we know that that can be particularly deadly for Black and brown people, especially Black men. So in this slide, we see, Eric Garner, who was approached initially because he was selling Lucy's. Cigarettes are highly taxed in New York City. from a public health perspective, people feel like taxing, cigarettes is a good thing, but for Black people who can't afford it and are hustling, it is the impetus for Mike Brown, Eric Garner's murder. We know Philando Castile was pulled over 46 times and issued over $6,000 in fines over his life, and that it was the 47th time that he was pulled over that he was murdered, and that recently Dante Wright in Minnesota was pulled over for window obstruction, which was an air freshener, and we know that that was a finable offense. So we know that the revenue potential is, again, not actually designed to create an environment where there's public safety. And so when I think about fees and fines as a type of structural racism, we're thinking about what these interactions are. What we're seeing is a relationship between elected and appointed governmental officials, law enforcement and judicial systems who are making this pact, again, so the connections across the nodes, and using that to extract money from poor people, and then using that money, not for things that benefit us. Like, it's not like they are using this to fund schools or anything like that, not that it will make it okay, but it's used most often to fund more police activity, more surveillance. So I wanted to try my hand, I guess, at thinking about fees and fines, the measurement of fees and fines as a type of exposure that is an example of structural racism.
And Brigette, before you go on, I should call you Dr. Davis, but I feel like I know you too well. So Dr. Davis, before you go on, so you mentioned that there were certain, like even looking in the initial reports that came after Ferguson, that 86 municipalities or counties or like communities had fines and fee structures. Did I misunderstand that?
No. So 80. Oh, sorry.
Yeah, go ahead.
I was on. So of the municipalities that have the structure. So if you have an existing police, if you have expenditures for police or expenditures for the judicial system, of those who have that existing infrastructure, 86% of them do collect fees and fines as a type of revenue.
Got it. So, and why don't, just understanding the structures and these why would a municipality choose or police system choose not to leverage fines and fees?
I think that that's a great question. And I don't really know. So like there is some variation. So, and I think I'll show it in a map when I show you the distribution of the fees and fines, but there are some state level policies that restrict how fees and fines can be collected. Like, and fees and fines also includes asset forfeiture. So that might restrict, and that's sort of why we're going to see when I show you the map some state level variation, and that's why we include state in our model. But I think that the discretionary part has more to do with, in my opinion, a willingness to use the policy to extract fees and fines in this way. I think that the variation that we see in how many fees and fines and the proportion of fees and fines as a percent of total revenue show a range and willingness to do this. I think that for instance, in Ferguson, one thing that again kind of cropped up is that Ferguson originally was a primarily white suburb and became Blacker over time, but the police department stayed white. And so in the process, and this is a thing that I hadn't thought about, but we might be able to measure this because of the data set that I'll tell you about soon. I think it's a decision that this is not their community. And so badgering and harassing people for money is actually not as big of an issue. Whereas in other places, people are finding other ways to fill in budgetary gaps. So right. I think it's a decision.
Yeah, that's interesting. I mean, that's exactly what the point of the question was, is like trying to understand if the policy exists and then now these kind of other systems and practices and policies come on because you're trying to extract, it's developed over time, or is it the opposite, which is almost everyone does this and then there's few outliers that said we're not doing this, right? And what are the processes by which that they've stripped out, but it sounds like, in fact, these are kinds of structures that have been implemented, policies that have been implemented that build, and maybe have to do with the compositional nature of neighborhoods and places, et cetera. So anyhow, keep going.
That's my hypothesis.
Yeah.
And so that's a great question. So I'm not gonna spend too much time on this, but pretty much one of the other aspects of my dissertation, that I was really interested in is trying to find data that we weren't really using that much previously, because I think one of the things that that we often hear is that, yeah, we have these theories or ideas about the ways that different policies or practices are influencing people's health, but we just don't have the data. And having worked in insurance and having lived a regular life where I move and all my debt collectors like know exactly where to find me, I just don't believe that the data is not there. I think that is there, and we need to just keep looking forward and then exploring the available data, checking out its quality, deciding if it works in the way that we need it to work, and then move forward with it. And again, this is sort of falls into this realm of like expanding our our toolkit of existing exposures to measure structural racism. And so what I found, which again, all the studies that, outside of public health that have been looking at fees and fines and used this data set, but when, at least at the time, when I searched in public health literature for census of governments, I didn't see it that much. Usually it was used to look at public health expenditures or maybe some social services expenditures, but it's such a huge, rich data set that one of the deliverables of my dissertation, hopefully for me, is that other people will use this, and I do have some colleagues who are using it. So the Census of Governments is an administrative data set whereby municipal governments, ranging from city governments to county governments and state governments, report to the federal government the revenues, expenditures, sales taxes, pretty much the input and output of all money, including intergovernmental spending. And knowing that money and spending is policy, in terms of thinking about opportunities to think about how structural racism is happening, I think that following the money is always a useful way to go. And then also what I'll mention later on in the presentation is that there actually are multiple line items in the census of governments in addition to fees and fines, where we can think about and measure police expenditures. So in the census of governments, the definition of fees and fines, which is again what this research is following, is a fee of fees and fines. And again, it's a data set because it's data, but this is literally a survey that governmental entities. Sorry, they're painting outside, so it's about to be kind of loud. I apologize. Anyway, the definition of fees and fines are the penalties imposed for violation of the law, civil penalties, forfeits of deposits, such as forfeited bail and collateral. So this is the definition that we're using. It's a single line item in the Census of Governments. And the way that we operationalize it is to take the total amount of revenue of it in this year, in 2012, as the denominator, and then set fees and fines as a proportion. And the reason why we chose to do this instead of fees and fines per capita is that we really wanted to get at this reliance on fees and fines. So again, the Ferguson report reported something like 35% or something of the revenue that was generated in Ferguson was through this fees and fines mechanism. So we wanted to use this as sort of a measure of a reliance on fees and fines rather than it having more to do with the amount of the fine itself or the underlying population, the number of the people in the underlying population. So for my study, I'm comparing, again, fees and fines as a type of exposure in an example of structural racism to county level birth outcomes. So again, we restricted to municipalities with judicial or police expenditures, and that's how we sort of established that there was necessary infrastructure to collect fees and fines. The fees and fines, or the municipalities, were assigned to counties and divided into quartiles. And the reason it was assigned to counties is because our birth data, which is vital statistics data from the US National Centers for Health Statistics, our lowest level of geography is for the mothers were the county. And then we compared, again, this assignment to fees and fines quartiles. So whether you live in a place where there's a high reliance on fees and fines or a low reliance on fees and fines, to the odds of preterm birth as measured by being born at less than 37 weeks gestational age and low birth weight. And our hypothesis, again, was that living in these places that are most reliant on fees and fines will be associated with worse birth outcomes because, one, again, police surveillance is a psychosocial stressor, and then two, it extracts money and time from individuals. And so all of these things are sort of known risk factors for worse birth outcomes. So here's the map that I kind of mentioned before. And I think, I don't know, I have been taught to think about the presence of variation, not just as something that's useful for our analyses, but is a reminder that these are decisions. And so you can see from our map that, you know, there's definitely like a dark, so the highest quartile is this darkest green color. You can see that in the South and in the West, is sort of like in this like Midwest, like mid-Atlantic region, there's a high collection of fees and fines, and it's making up, in some cases, up to 30% of the revenue for that particular county. And then we also see like in the Midwest that most of the counties in those areas are falling in this lowest category. The entirety of Wyoming, the entirety of, or the majority of Kentucky, the majority of Nebraska are actually in
Look at Georgia.
Yeah, Georgia's really interesting, right? Because, and this is what I mean, where there are state policies that are likely influencing how much people, how much they actually can extract. Yeah, but Georgia and Arkansas as well, where the majority of these places actually do fit in this highest category. And so when we can maybe talk about this later, but we were having a really hard time. And I think if I were to continue to use this, I still want to think about how best to operationalize the fees and fines, because there's so much variation, again, ranging from 0, which I think is a meaningful 0, to 30%. Using it continuously was really, really wonky. So we spent a lot of time trying to think about how best to do it. We landed on quartiles. I'm not wedded to it, but that is what this paper uses.
And can Louisa Holiday, who's hopefully someone you'll meet in the future if you haven't already met her already, asked the question, the 4th quartile, and I noticed that too, is a really big range.
Yes.
So what's the variance within that quartile? Like, first, you just mentioned, you just chose what's been used before, but how does that look?
Okay, I have a slide for you.
Love it.
This down
here. Oh, we're going, to the extra slides that I'm sure
it's enormous.
All the time.
It's enormous. Yeah. It's really, and so that's why it's like, you know, when my reviewers are like, what's going on? I'm like, I get it. You know, if you have a better idea, I'm open to it. It's huge, but, and maybe it's just my, this is just the me, where I just like, I find the descriptive statistics to be more interesting than like any sort of causal relationships in general. I think that the fact that this final quartile has such a huge range is something that really I would like to, in the future, leverage to understand as an exposure. Because I do think, again, this is a decision that of the people of the counties with the highest fees and fines, it ranges from, and I think I have in another slide, you'll see the median. So the median in this highest quartile is still 3%, right? But there's a ton of outliers. And the outliers are, these are decisions, this is discretion. So I think it's meaningful, but I do sort of see the point where the variance makes it like a kind of an odd, it makes it really difficult. I'm not gonna lie. Okay, were there any other questions? I think I saw a few more pop up. And I'll just bring us to this place, unless we want to keep looking at the map.
Oh, sure. No, there are. Thank you. You're doing a better job moderating your own talk. Someone's asking, Kentucky appears to be a regional outlier in terms of reliance. You know, have you seen any explanations on that?
No. So I think that another thing that I want to do moving forward, and I think that a lot of the research out on fees and fines has been more hyper local. And I chose to look at this nationally because my goal was to think about fees and fines as a context. So I can't say specifically, like, I know that Kentucky is good on this. The places where the ACLU is currently suing for around like fees and fines and civil rights violations are South Carolina, Washington, I think Ohio, and one other place. So I think I know the places that are sort of like high outliers, but no, I don't really know why. But I think, again, that this gets at is discretionary, right? So in Kentucky, they've decided for one, you know, somebody decided that they can generate revenue through other means.
Yeah, I mean, I think this is pointing to, and I think, you're threading this needle beautifully of looking at kind of this variance and also understanding where the outliers are. Like Kentucky, you might expect to look a lot like Georgia and Arkansas, and it doesn't. So,
right. And then what's the difference between Kentucky and Georgia?
yeah.
I mean, I'm gonna say probably Black people.
And then secondly, another question Edgar is asking, are the excluded counties, what are they? And then are they indigenous, was the specific question.
Yes. Okay. So there, yes. I think there's one county in South Dakota that I think it's called Oglala, Dakota, that was excluded. And so the reasons that the inclusion criteria were that there was a population in the county of greater than 2,500, and then they had to have the infrastructure, either police expenditures or judiciary expenditures. So there were only 7 counties excluded. And I kind of had to go back over and over again. And I did spend a lot of time trying to figure out exactly why they were excluded. I don't have it off the top of my head, but I have it in my paper. I want to say maybe 3 of the counties didn't have the population size, and I think 4 of the counties didn't have the infrastructure. So it's 7 counties out of 300 and I think 3,140 counties. And so I haven't really dug into it, but yes, I know for a fact that when I sort of had to dig into it, a few of them were indigenous. And then I think there was this other thing that happened where some county, like the governmental seat was in like an adjacent county. And so they weren't, so if the governmental seat is in an adjacent county, then they didn't, because the Census of Government's data set, the ID is not like a FIPS, like it's specifically a governmental, it's an ID for the government itself. So yeah, it's some weird things that I think that if people want to look at the Census of Governments, which I think they should, we can explore and again see if this is a useful data set for us to use, because there are some caveats. I spent easily 5 months just trying to get the data to be useful in this way, because it's also not designed to be used for research. And I also think that they make it a little bit difficult because I think it probably has some kind of damning information in it. That's my idea.
Great. I think that answers all the questions that are in the chat for now. Thank you.
Okay, sweet. Okay, so this kind of gets at what we were talking about before. It's sort of my descriptive statistics. So across the 4 categories of fees and fines, again, acknowledging understandably that this highest level of fees and fines, there's wide variation in what this category looks like. There were some notable patterns in the revenue sphere, as well as county characteristics and the maternal characteristics that we, again, assigned to the counties that I think, at least to me, support my hypothesis that this is discretionary. So, and also the other hypotheses, right? Because I'm not the first person to think about this. So first, like we saw in other research, the median revenue in the highest quartile is much lower than in these middle 2 quartiles. But what's interesting is that in the lowest quartile, the median revenue is also pretty low. So again, this is the median revenue for the counties themselves. So even in these counties where fees and fines, like the median fees and fines are less than 0.5%, again, we know that it's not just the sort of absence of additional revenue that explains the difference between the lowest and the highest quartiles of fees and fines. Excuse me, I thought that it was really interesting. When we sort of expand this to all county characteristics, again, we see the pattern that we would expect, that the average proportion of Black people in the county is highest in the highest quartile of fees and fines and lowest in the lowest quartile of fees and fines. And then you see the opposite, which is, oh, right, PLC. So the PLC is the proportion of white people minus everybody else. So we also see a similar pattern where the lowest proportion of white people is in this highest quartile of fees and fines, and then vice versa for the lowest quartile. We also see that even though the median income is lowest in this highest fees and fines category, so if we're thinking about on an individual level, that these are people who are more likely to not have the funds to be able to pay for the fees and fines. And then I'm also using the ICE measure, so the index of concentration at the extremes. And I have it reverse coded so that that a lower ICE number or a higher ICE number is associated with a greater proportion of Black people in the county, and a lower ICE number is associated with a higher concentration of White people in the county.
Okay, so I just want to make certain that we're understanding you correctly, and there's a couple of questions here. So just to review the primary finding, and Olivia is also mentioning this, this is the median annual revenue?
Yes, for each county.
For each county in these 4 quartiles, correct?
Yes.
And what you're finding then is that in the lowest and in the highest quartiles, the median revenue is about the same.
Yes. Yeah. And so when the other studies have looked at fees and fines per capita and looked at and you looked at it continuously, there's a trend towards lower revenue as being predictive of the collection of fees and fines per capita. So again, the amount of fees and fines generated per resident. But at least I think that's sometimes that can happen when you categorize things like this, is that it's not a linear trend. Yeah, so I do think that's important because again, it's discretionary. It's not just from what I'm hypothesizing and what people are finding, it's not just sort of a desperate need to fill in the budgets because of revenue being low.
Right, like, so in the highest fines and fees, a big percentage of their funds are coming from these fines and fees, but they're not making a lot of cash.
No, they're
right?
not.
Compared
And then
with
again, on the lower end, they're not making that much cash and they're getting the revenue from other places. So again, I think that again, the variation is just like this is a decision that's being made. And it seems to be a decision that's being made based off of the underlying population, less so than the, at least, again, that's my hypothesis. And so we do see a similar pattern among the mothers themselves. So again, we have mothers assigned to counties based off of their into quartiles. And we see that the majority, that the largest proportion of births to Black mothers happens in the highest quartile of fees and fines. The lowest proportion, or the second lowest proportion of white births to white mothers is in this highest quartile. And if we think about fees and fines themselves as being an exposure, what we're finding is that among Black mothers, they are more likely to be exposed to this particular exposure, and less likely to have the protection of, let's say, on the low end of the fees and fines spectrum. We also found a trend in educational attainment among mothers. So the highest proportion of mothers without a high school diploma is in this highest quartile. And then I looked at different sort of maternal clinical characteristics. So pregnancy hypertension, diabetes, and chronic hypertension. And we did see sort of, again, a higher trend, but not, I included hypertension in my models, but you didn't see a ton of variation. We didn't see any variation in gestational diabetes across the 4 quartiles. So here are my results. And so in this is sort of our first pass at examining preterm birth and low birth rate in relation to these quartiles. This is not our crude model, so I'm controlling for maternal socioeconomic status through education, because we don't have income in this data, and then clinical characteristics, so including age and sorry, I just blanked, age, maternal comorbidities, etc. I have it written down somewhere. I think it's not on the slide. And so we use 3-level, multi-level models. So we're clustering both at the county and the state. And again, we're doing that because we expect, and other research suggests, that there are state level policies that restrict how fees and fines are collected. And so what we found is that in these 2 highest quartiles of fees and fines reliance, again, controlling for maternal demographics, socioeconomic, and clinical characteristics, that residing in these highest categories were associated with a 5 to 6% increase in the odds of preterm birth and a 5% increase in the odds of low birth weight. And both of these are statistically significant at the 0.5 level. Okay, so in our next model, I wanted to see if sort of the inclusion of these segregation level measures change the relationship between fees and fines and birth outcomes, because again, at least one of the things that we hypothesize is that this that it is operating to some extent through racial composition. So we would, if we expect this to be a mediator, we might expect the relationship to become null. And what we found is that when we include percent Black in our model, so again, percent Black at the county level, we see a similar trend. It's the association is weakened, but it actually remains significant, at least at the 0.1 level, and so marginally statistically significant. So associated with a 3% increase in the odds of preterm birth. And I'm actually just focusing on preterm birth here. The low birth weight relationship became null pretty quickly, so I'm just focusing on the preterm birth for time. We also found something similar with our ICE measure, which we would expect because it's capturing, I think, relatively similar aspects, because I didn't use the socioeconomic ICE measure. I just looked at ICE race. And then again, we see sort of a similar pattern, but doesn't become as weak as the relationship between percent Black and ICE race, where in these highest quartiles of fees and fines, the odds of preterm birth are increased in the 3rd and 4th quartiles compared to the lowest quartile. And then we see these segregation measures, which are down at the bottom, they're acting the way that they normally act in terms of their relationship with preterm birth. The proportion of percent Black in the county, the proportion of people of color in the county, all are predictors because of existing racial structures that increase the odds of preterm birth in these populations. And so finally, what I wanted to do, so my other models don't control for race in any way, because again, we assume that race and racism, specifically not race, racism is one of the mechanisms through which this is affecting people. But I did want to stratify by maternal race, which is a form of controlling, because I did actually expect that the relationship, at least the trend, would hold within strata of maternal race. But what we found is that this is only true among white mothers. So among white mothers, residing in the highest quartile of fees and fines was associated with a statistically or marginally significant increase in the risk of preterm birth. But that wasn't the case for Black mothers, and also the trend disappears. So at the bottom, there's a p-value for trend. And we see that that's the case for non-Hispanic white mothers, but not for non-Hispanic Black mothers. We see a similar trend among Native American mothers, and I included Asian and Pacific Islander mothers, and mothers of multiple races as well, but I'm only focusing on these because these are the most interesting of the findings. So we do see this trend, again, not significant among Native American mothers, but we do see a really strong trend. And I think that actually for this measure, or for this category, is that the non-significance has more to do with population size, which again is an output of structural racism and genocide, because the trend itself is relatively strong. So I think what we're actually seeing is positivity issues more so than a lack of a relationship. And then for Latinx mothers, again, we don't see a lot of variation across the 4 quartiles, and they're all non-significant. Oh, and so here at the bottom, oh, also I forgot to mention that in addition to the maternal characteristics, we're also controlling for the county level population and total revenue. So again, to kind of capture this idea, because there was variation across these categories in those spaces, or across the quartiles for those reasons. So that was it. That's the end of that. So I just wanted to, in terms of interpreting the results, we found that from our descriptive statistics that reliance on fees and fines is racially and socioeconomically patterned. Again, this aligns with other research that already exists. That living in these areas is associated with an increased risk for preterm birth, and to a lesser extent, low birth weight. That Black mothers and mothers of color are more likely to live in these counties that are reliant on fees and fines. So there's an increase in the exposure, but only among white mothers does the relationship hold once we stratify it, which again is controlling for race. So that is probably one reason why those relationships disappear once we stratify. I think that one of the things that I hope to do with this study is to kind of capture context, because again, I wanted to say, what is the difference between living in a place where, that's highly reliant on fees and fines compared to living in a place that's not highly reliant on fees and fines. But I think, again, based off of the results from the stratified analysis, that that we probably do need to look at, and I think we should, as public health professionals, be looking at individual level exposures of fees and fines and its impact on birth outcomes. Because again, among Black mothers, one of the hypotheses is that that the reason that the relationship disappears is that even in these places least reliant on fees and fines, that there's still exposure to the increased police surveillance and then and financial extraction through other means. And so once we stratify by race, we might actually there might not actually be variation in the individual level exposure once we stratify. So I think that could be one of the reasons why that relationship disappears. And so I think that just supports the idea that if people are interested in this on an individual level, they should look into it and maybe start adding it into surveys. And then also this, as I mentioned, with the positivity issues among Native American mothers, is that only white mothers are present in all 3,000 counties. So we start to get empty cells that also could influence the outcome, the statistical significance that we find. Another thing that we had to contend with is that we know that a lot of the targeting, even the targeting, like the context, like if we talk about a hyper surveilled area, is happening at the neighborhood level. So one thing that I would like to do, you mentioned like things I might want to do in my postdoc. I'm hoping to work with some existing relationships here to see if we can look at fees and fines, or the collection of fees and fines, or some other sort of aspect of like the political economic relationship between the government and the police at a lower level, because I think that that's where most of the action is happening. And then another thing that we have to think about is that these data are self-reported. So even though they're susceptible to audit, so we're hoping that most governments are not lying to the federal government, that obviously we're still dealing with data that was never really meant to be used in this manner. But again, I have not yet seen this data set be used, and I haven't seen people look at fees and fines in this way. And so I think that even though there are a lot of things that I would like to fix and maybe do differently, it's still a first pass. Like my advisor says, it's an N of one. And I just think, I think the results are really compelling, and I hope that other people look into it as well. So I feel like I'm running out of time, I'm sorry, but I wanted to share with you all the census of government just like as a data set, because like I said, I use this for fees and fines, but there's other data as well.
Don't rush either, you're doing fine.
Oh, okay. So here's a QR code if people want to get to the Census of Governments program very quickly. But again, we're talking about self-reported financial data. It's a census done every 5 years that dates back to 1957. And so it's every 5 years on years that end with 2 and 7. So there is a possibility to link across years. I didn't do it, but I have a colleague who has done it. And again, this is like, I think the most exciting part is about like exploring it as something that is like, is it valuable? Is it useful? Does it provide us any data that we can use to think about structural mechanisms that influence people's health? There's also a sort of an inter-census survey that samples a subset of eligible governments. So just this alone, I think from a public health perspective, should be something that people are excited about if they have the skills to do this. I'm also like, I could be better, I'm learning. But I'm positive that folks, and I have colleagues, Dr. Cowger, for instance, who has just really dug into these data and like are finding out really interesting things. And so as I mentioned, there is, so on the left, we have the classification manual for the Census of Governments, and they show you how to categorize the individual codes. So I have the police protection codes under general expenditures here. And there's another, it's a nightmare of a data set. So if people really want to look into it, I'm happy to talk to them as well. You have to look at like 7 different things to know what's going on, but you can also, you can back into what the different codes mean through the technical documentation that they offer in the zipped file for the data, and like cross-referencing it with the classification manual. And I don't know if I mentioned this before, but these data are required to be publicly available by law. So it's out there and people should be using it. And I'll mention this one other thing because I'm pretty much done. After the UN census paper came out, which is like in 2017, where they specifically mentioned Ferguson, and looked at patterns of fees and fines using these data, this data got really hard to find, to the point that I had to actually reach out to the authors and kind of like sanity check. I was like, you know, y'all say it's here, but it's not here. And they were like, oh, that's weird, it's not there. And so I actually had to go into the sort of back end of the CDC's website to get the data. And I think that the fact that when people are ready to get rid of data in this way and make it really hard to find, it also probably has a lot of really compelling stuff in it. So here's a quick map that I made a while ago that looks at police expenditures as a percent of total expenditures using the same data set. The categories are not quintiles. It uses the Jenks mechanism, which is like, is meant to like leverage the variation across the categories. So the category like buckets might not necessarily be super intuitive, but pretty much what you see is that, again, in this highest category, the dark purple, where we're seeing 20 to 43% of total expenditures going to police expenditures. And in other categories, like in the upper Midwest, et cetera, where less than 5% is going to police expenditures. You see that, again, this is discretionary. You see the patterns in the South, you see the patterns in the West and in the Midwest and St. Louis right here in this top category. And then you see very low levels in other places around the US. So again, this is just like an example of something that exists in the Census of Governments data set. There's also data about corrections expenditures, but I'm not super savvy with that. So you would have to look into, again, to see based off of the technical documentation, like, does this mean what you think it means? Like, is this like a useful variable? But again, I think, like I mentioned, that my hope is that more people will look into it and decide if this is something useful that we should be thinking about as a way to measure different types of structural racism or legal system type variation. So here's some resources and references that I used. Dr. Alexis Harris is the person who has done the most of this. If you haven't heard of A Pound of Flesh, Monetary Sanctions as a Punishment for the Poor, it's really good and also devastating. But like I said, there's tons of people who've been doing this work as well, outside of my field, but it gave me an opportunity to really delve into criminal justice data and economic data, and I feel like I learned a lot. And that's it.
It's so great. It's just so great to hear what you're up to. And I just appreciate that. I mean, there's so much about kind of your presentation of just bringing the you into your work, and also really kind of bringing us, I think that buckyball is just this beautiful, beautiful metaphor. Like, it now sits and lands in my head. So
yeah, I didn't do that. That's Dr. G, Gilbert
yeah,
G.
I hear you, but it also is just this beautiful way of putting it together, because it really is interlocked, and it ties into kind of our last 2 weeks ago with Dr. Bowleg. It's like there's all these interconnections that are hard to measure in quantitative data. So how do you do so? How do you do so authentically, that represents these social contexts? And her answer was like, qualitative work, but
yes, that's something I'm hoping to get into too when I'm out here.
Yeah. But there's part of my mind that is really quantitatively aligned. So anyhow, there's a bunch of questions. So let's turn to those first. Whoa, 12 new messages. Okay, so lots of good questions. And maybe what we'll do is just take them as they came in. And so this was, I don't think I saw it as it came in, but, follow up for Louisa Holliday's question specifically. And so going to that kind of extra slide that you presented at the fourth quartile, she's wondering if you looked at different sorts of independent variables in terms of the rates of fines and fees for birth outcomes. So for instance, did you cut it in a different way? So not in quartiles, but like took arbitrarily 20% cut, and to see if the findings were any different.
Yeah. No, we decided that we wanted to make the define the exposure first, but I do think that would be really helpful. And I think the thing about, so my fees and fines paper was the first that I completed out of my dissertation. And I think another thing that there are a few other things that I think I would do a little bit differently about it. I as I in the process of my learning, I think I may have gotten a little bit better at how to handle the variation, like the skewedness of the fees and fines data. A lot of the issues I was running into were model based. And so I think that if I were to do it again, I might at least attempt to keep it continuous. Another thing that we wanted to do, that we didn't do because of time and energy, was to look at fees and fines per capita. I still stick with the idea that the reliance on fees and fines, they're using it as a percent, was the best way to do it. But yeah, there are a lot of different things that that because of my timeline and because of how we wanted to sort of keep we didn't do a lot of sensitivity analysis, I guess, afterwards, but I don't think that would be really useful. And I would be really interested to see that. My hypothesis is that what's really happening is happening at the tail end of this variation. And that, and we did sort of see this because we initially started to use quintiles, and we found that the three middle quintiles were not super different. And so we just kind of chopped them in half and sort of separated them out that way. But yeah, I think that if we were even if we did something where we captured the top maybe 10% of fees and fines and the lowest 10% of fees and fines, and then kept the middle as a sort of a broader range, then we might see something different.
Yeah.
But I think that the pattern would be the same. I think what will actually happen is that the way that it's cut up now is hiding some of the relationship because it's happening most likely at this higher ends.
That's great. So many comments here. I'm hoping Lisa has an idea of how we save these. So I suspect you would have mentioned it if you had done it, but questions about looking at the rurality of spaces of counties, if you looked at stratified analyses that way.
So we control for population size, which I didn't mention before. Because we do know that there's a relationship between the amount of the first iterations of this were entirely descriptive, and I don't have them pulled up for you, otherwise I would show them to you. But there's a really strong relationship between population size and the collection of fees and fines, such that the higher as population size increases, then so does the collection of fees and fines, which is why I think looking at it continuously. The fact that once we categorized it, using the quartiles, which I think you do tend to lose, power, obviously, when you start to categorize things like this. But I think it was really interesting that our highest quartile, despite the continuous relationship between population size and fees and fines, that we actually saw lower population size in this higher quartile. And so we kind of got at rurality in this way, but we chose to control for it rather than measure it. But again, I do think that there is something happening there too. I think that in counties that are more rural and more white, you actually are probably going to see less fees and fines and a lower reliance on fees and fines and a lower relationship, because it's not because the decision to be extractive is, if in my hypothesis, racially motivated.
Got it. And then before we go on to that, so there's so many good comments here, so I'm trying to move through quickly. I think there was someone here that, to that exact issue about Kentucky, Terry Cowger says, wonderful to hear your work. And then Kentucky, she links that it's one of two states that limits what municipalities can keep. So send it to the state. And so that's interesting, again, in this variance of the context and the policy. And of course, you structured analysis, so you clustered by state and then counted. So,
yeah, Dr. Cowger is another person who's been using the COG, so I trust her because she's thorough.
Well, she's on there, so that's great. All right, so and then what there's a set of questions, and then also Ben Howell in our group also. And I suspect because of, I was writing this furiously. Thank you so much for introducing us to this amazing resource, and also for creating the resource yourself. The longitudinal nature of it, I think, probably would enable some really good difference analyses or change in time. And just looking at how the maps have changed over time, I think would be profoundly interesting, especially as the population demographics change in time and can enable you to use instrumental variables and other tests of causality. So all that I think is there, and it's interesting to think about corrections. All right, so two other comments that came. So one, we'll turn to Dr. Kershaw. So he asks you, might the hyper-surveilled effect have intersectional effects with differential race impact across gender and race, for instance?
Yeah, so Dr. Sewell's work really focuses on hypersurveillance and the gendered impact of hypersurveillance. And so some of the work that they've done found that like the worst anxiety and PTSD symptomology is among men, because men tend to be hypersurveilled, especially in this stop and frisk category. But I think that yeah, I don't know. So I'm guessing maybe we would expect that we chose an outcome that is primarily focused among a population that's less likely to be hyper-surveilled. So maybe the health impact, if we chose another health outcome, might even be stronger. And I think that probably is true if we were to look at like a mental health outcome. So yeah, I do think it probably would be gendered, but then I'm also thinking that it depends, and this is something that you can't capture in this data, it depends on like where the fees and fines are coming from. Some of it is gonna be bail, some of it's gonna be traffic tickets, some of it's gonna be an accrual of money due to bail or traffic tickets. And so if we were able to get this individual level data, my guess is that there are some aspects of the fees and fines collection that are not gendered. Parking tickets, traffic tickets being one of them. Yeah. So I don't know. I think that's sort of the thing that I hope to kind of look into if I were to do a study where I was able to get individual interactions with the police through this way.
I think that that's a really great next step. You know, you outlined that getting individual level data will help you kind of really push forward the hypothesis of this differential impact that you're seeing across racial groups. The other place that I always have wondered, and, you know, we've talked in our group, but also just thinking about kind of what's the you know, negative control in your study, meaning, so you can imagine that, yes, I'll certainly buy that fees and fines are an expression, a manifestation of structural racism. And perhaps there's a more distant way that you can imagine this link, but you would expect that maybe fees and fines would have more impact on preterm labor or, you know, poor health, poor birth outcomes because of stress, but maybe not like a preventable hospitalization due to hypertension or an appendix rupturing. Maybe still there is a causal path, but like testing that out, I've always thought also that would also build the argument, even when you're not, you know, using kind of, you know, diff and diff models. So anyhow, I think that those are really interesting next steps. Okay, you have another question here. It comes from Dr. Puglisi. So your study is fascinating, and it also makes me think of Heather McGhee's hypothesis in The Sum of Us, which is that the ways in which racism and racist policies negatively impact white people are also, you know, important to capture. And she's bringing up the question of whether or not counties that hyper rely on fees and fines also underinvest in communities in some way, like their health system, their public health infrastructure, or hospitals that might have impacts on the white mothers. And so wonder if you've thought about that or thinking about ways of measuring that.
Yes, exactly. So I think that, again, my friend and colleague, Dr. Cowger, is doing stuff like this, and it's exactly the same. The case for fees and fines and for expenditures, especially expenditures, because expenditures are about an existing pot of money and how it's being used. Yes, of course, if it's going to one place, it's not going to another place. And I do think that that's something that I'm interested in looking at. And I think that what it kind of links back to the thing that you said before, where there's like, it's almost like a seesaw, maybe, I don't know, where there's like, so one of the things when we were thinking about modeling is like what is the best distribution to model this as. And one of the things that we were thinking about is a sort of a zero inflated Poisson model, because it is a zero inflated exposure. But one of the, I don't know, this is the things that I pushed back on, and if I had some strong statistician support, like I think that this is something I would really want to think about, because when you do these sort of zero inflated models, it's assuming that the distribution of the zero is a separate distribution than the other distribution. And my argument is that it's not, that there's just as much of a decision to not use fees and fines in this way as it is to use fees and fines in this way. And that it's the decision to do so and the racialized decision to do so that is the structural racism, not the fees and fines themselves. Because if you go to a place where there is a collection of fees and fines and they're not, and it's everybody is equally impacted, then I actually wouldn't call that structural racism. I would just say, I think it's still messed up, but that doesn't actually capture what I think is capturing. And so in a way, I think that this is probably, again, an underestimation of the relationship because we are misclassifying some of the exposure as structural racism when it might not be. And then it also gets us away from this idea that there are other possibilities. Like, again, my original argument is that we don't want to rely too much on composition because we don't want to assume, for instance, that segregation as measured by, let's say, the similarity index, it has the same underlying mechanisms of poor health in one place and the other place, because that places the onus on the people themselves, on Black people, as evidence of structural racism, when there's enough variation and enough of us in this country to know that there are places where we are safe, that there are places where there is protection, and that is the thing that we should be striving for. And so I don't know, one of the things that I've been thinking about a lot that I wasn't able to do in this because of time and all those different things is how do we sort of capture the natural variation to understand that this exposure that we're calling structural racism, even this exposure itself might be operating in different ways in different places based off of the policies and the decisions that the actors are making.
I'm just gonna mute for a sec. Brigette, I think that's so interesting. I'm sort of obsessed with the fact of what you found in the white mothers, because I almost think it takes it to the extreme. Like, those were the same communities that had the highest proportion of Black residents, if I remember your schema correctly.
Yes.
And so what you saw there, in my mind, like really thinking through Heather McGhee's lens, is like, and she gives the narrative all the time of like the willingness to fill the public pool. Like, there were communities all across the country which would rather fill the community pool than share it and desegregate it. And that then all those white families didn't get the community pool either, right? But that was okay. They were willing to do that to not let others in. Yeah. And it almost speaks to me, like, I almost feel like that finding is so indicative for that reason, that the levels to which these, because from the buckyball model, it's like, it's not the fines and fees per se themselves. It's it describes the infrastructure of that community.
Exactly.
And they are so willing to tax their own, to find their own residents, and then maybe to underinvest in their communities, that you even start to see the negative health and outcomes in white mothers that are unexpected and otherwise, right? And so, yeah, I think that's really intense and interesting.
No, I think that exactly to your point, that in terms of, if we, again, I wanted to capture context, and I do think along these lines that that this willingness does place white people in harm because of, again, the proximity. But I also think that there's something that, which again, I was kind of waddling between the individual versus contextual thing, but I do think this is probably the only case where there actually is variation in individual exposure, because I think among Black mothers living in these low versus high probably does not create much variation into the police contact lens, where you actually do see it among white women, and that's why you see that relationship. Right, it is the filling of the pool, to willingness to expose everybody to deny or to extract from us.
Brigette, I didn't realize, because I was just focused on the chat, lots of questions, and this is my favorite sort of seminar where, like, there's just more questions and more questions. You really stimulated kind of our appetite to want to understand and learn more. So and we'll just keep going through this, and then we'll save you the questions for the future. So you know, in your talk, there was an initial criticism perhaps of the segregation measures, as you talked about, like using these singular composite measures of individuals that live in communities, percent Black, ICE, but they also seem to be the strongest predictors of the outcomes, right? Than your proposed fine and fee measures. They're significant in both models, and with you know, higher effect sizes, the higher odds ratios. So wondering if you could comment on that.
Yeah, I mean, I think so. This is when I was first pitching this to my committee, and this other thing that I've been thinking about for a long time. It kind of came up, right? Which is like, why use something that we expect to have sort of a weaker relationship than something that we already know. The measures of segregation are extremely predictive and remain extremely predictive. I think partially because segregation is one of the mechanisms through which structural racism people get exposed to it. Like I said, on the micro sense, and there are studies that find this, that like, you know, most of the, let's say, the extraction from communities are done at the neighborhood level. And so segregation allows, you know, you to pick a neighborhood or a section of town to implement whatever these policies are. So I think that in a way, segregation is capturing multiple exposures. And that's, I think, both what Dr. Sewell is saying in their racism reification process, and kind of what I'm saying in this as well, is that segregation is and will always be predictive because of the ways that structural racism works. But my issue, and I didn't mention this here, is that if we continue to think about segregation itself as our primary exposure, then our only viable option is integration. And we can, I mean, I'm not a housing specialist, but I live in a Black city, and integration is a gap stop to gentrification. Like, if they don't want to live next to us, they're not going to live next to us. And so if our only policy solution is to is integration, then it doesn't actually get at what the issue is, which is that people are using segregation to influence people's lives. And then two, is likely to displace people as well. And so I actually always expect that segregation is going to be the most predictive, because it has been the most predictive in the past, and because it's capturing a lot of things happening at once. But my goals for thinking about and trying to find new exposures is to find things that we can actually intervene on, or at least advocate for. I don't really feel like it's like I need to advocate for integration in neighborhoods beyond the fact that living next to white people is protective because white people have access to resources. We should have access to resources too.
Great, thank you for that. And you know, this turns, maybe our last question, I think, is like turning to structures and solutions. And so Noel Vest asks you, interested in your thoughts on programs like civil survivals in Washington State that aims to waive fines and fees through an LFO reconsideration days. Are programs like this an answer to these issues? Are there other ideas that you've been thinking through or have seen to properly deal with these structural issues?
Yeah, so like I mentioned before, Washington was actually one of the places that's being sued because of the civil rights violations associated with the accrual and inability to pay. So it seems like they are choosing this as a solution. And I think in California as well, you are seeing there is a push to start removing fees and fines in general. I think that is always the solution, because again, as Dr. Puglisi mentioned, it's affecting everybody, even when the goal is to harm us. And so doesn't like just get rid of it. I think that is the policy solution, but I'll be really honest, I haven't thought much about the policy solution, because one of the things I'm really interested in is thinking about how we measure and operationalize this. So mine has been more like a PI, like detective sleuthing thing, more so than like a direct focus on fees and fines itself. I've had experiences with them. The Ferguson report brought it to the attention of a lot of different people. And so it is close to home for me, but I don't know if this particularly is like the place where I'm going to live as a researcher. I think that where I would like to live as a researcher is trying to think about and access different data sources and giving them to people who have, an interest and like the statistical abilities to make them work. And then I'll just go back to doing some, being behind my computer and finding new stuff, because I really had to track this data down. So
Amazing.
that's not my thing, but yeah, I think that any policy solution that doesn't extract or like gives money back to people and stops extracting from us is something we should be aiming for. And which we couldn't be able to do if we were just looking at segregation, I'm just saying.
Right, right. To your first point. And, Alexis Harris, who
Yes.
Brigette's referencing, was strongly involved in the work that's going on in
Oh
Washington.
yeah, because she's in
And
Washington too.
big bridge, right, of where research really and advocacy can drive innovative policy changes. So, maybe we'll end with this question, which is getting to where you want to live and kind of you in the weeds of these data and these data sources, which is illuminating, right? So this person writes, wonderful presentation. Do you think that there are potential issues or discrepancies in how expenditures are classified and categorized by local and state governments before reporting, either unintentional or intentional misclassification, or differences in how governments are interpreting the categories for which they're reporting expenses, or even, intentional missingness that could impact comparability? And can you speak to that?
Yeah, I do. And I think that the only thing that we can do as researchers is to just explore the data and figure out the quality and determine if it's useful or not. Like I said, my colleague, Dr. Cowger, has looked at these data, and we found like something really weird in Missouri where like, this is something else where like Missouri apparently is spending a lot of money on public health. And I'm from Missouri, and I can say, that don't really seem right to me. So we kind of went on like a rabbit hole trying to figure out like, why does it seem like Missouri is spending all this money on public health? Yes, I do think that is happening, but we can't know until we explore it. And so I do, for the fees and fines variable, it was kind of straightforward. And I clustered at the county and the state. And so I made an assumption in my models and in my paper that because I'm looking at this variation at the sub-county level, that we're kind of capturing that. But yes, I think that if anything, that's just a reason for us to continue to look into it, like just do some descriptive statistics, see if it means what we think it means, and then decide as a community if this is something that's useful for us and not. But up until now, we haven't used it at all. So either it's there and it's going to be good, or it's not something that's useful, but we won't know until we try.
Great. And with that, I just have to say, I thank you again, Brigette, Dr. Davis, for imparting your knowledge and passion. I mean, some of the things I just really love about seeing your research and your career evolve is kind of really kind of how you bring the you into this sort of research, and also like getting really nitty gritty into the data. Your comment about the 0+1 model, I think, is fascinating. And so, I'm hoping that this has been a good opportunity for you. There's lots of questions that still remain. Hopefully the conversation will continue forward, but I thank you for this. She is our last speaker in our kind of fall seminar series. And thanks you guys for all tuning in. And then we look forward to joining you in the new year in 2022. Hope you guys have restful and safe holidays. Thank you so much.
Thank you for having me on. Thanks for engaging with my work. I'm really excited about it.